Oh, awesome. Thank you for whoever started recording. So today we're here to talk about and share a broad overview of Medicaid. We're going to talk about how it works, who can get it, what it covers, how to get and use Medicaid services. And then we're going to talk a little bit about like the current policies that are impacting budgeting related to Medicaid and what that might mean for immigrant and mixed status families with Medicaid. And before I continue as well, these slides have a lot of information on them. And our goal in doing that is just to make sure that whoever picks up, or if anyone picks up this slide deck after today, they can still get that comprehensive overview and feel better equipped to have conversations around Medicaid. And so that being said, we won't go into extreme detail on every slide, unless of course there are any questions. So if any questions come up at any point, please don't hesitate to ask us. We really want this to feel like an open space and like a good opportunity to do that. All right. Okay, so who are we? We are with NC Integrated Care for Kids, aka NCInCK, and it's a pediatric care management model for children 0 to 20 years old with Medicaid and who are living in these 5 counties right here. So Alamance, Orange, Durham, Granville, and Vance. And some of the things that make NCInCK unique is that we're able to identify children who would likely benefit from additional support across the core areas over here on the right. And not only that, but families can stay engaged in INC care management for over a year if that's something that they choose. Whereas other care management programs tend to be around like 3 to 6 months. So the length of time that we can offer for families is really helpful for building trust and effectively meeting the family's needs. Mhm. Oh, awesome. I popped into the chat and I saw that Eleanor dropped our link. So if you're interested in learning more, feel free to check our website out. Okay, so a brief level set. What is Medicaid? So Medicaid is a health insurance program that is funded by both state and federal dollars. And while all states have to offer a list of specific services, each state can choose to offer additional programs or services beyond what is required. And that's something that Eleanor is going to talk about in a little bit. And we know that approximately 40% of people who are enrolled in Medicaid are children, and the remaining folks are adults that fall under more one of these categories: low income households, senior citizens, people with disabilities, or folks who were just recently covered by Medicaid expansion. All right, so what is Medicaid Managed Care? Not to be confused with Medicaid Care Management, which I'll go into a little bit more later as well. And I'm sure many of you are aware that there's several different types of Medicaid plans. And depending on who you're talking to, it can be like a really confusing topic. And I'm sure that like most of us here are familiar with the standard plan, which is like right here at the top of this table. And maybe y'all have heard of tailored plans, which is for people with substance abuse disorder, any major behavioral health needs, or intellectual disabilities. Then we have Medicaid Direct. This is administered by the state, and it is for people in specific programs like CAP-C or foster care. We have the Eastern Band of Cherokee Indians Tribal option. This is for federally recognized tribal members. And then set to launch in December of this year is the Child and Family Specialty Plan. And this will be for children who are in foster care placements. Before I move on, are there any like current questions that anybody has? Kind of want to pause for the cause real quick. Okay, awesome. I'm going to go ahead and pass it off to Eleanor.
Thanks, Kirsten. Most of you are probably hopefully familiar with Medicaid expansion by now, but this is an exciting thing that happened in our state in December of 2023. So under the Affordable Care Act, states have the choice to say we will offer Medicaid to additional people and get federal matching dollars for it. Before expansion, you had to have, if you did not have a disability and were an adult and we're not pregnant, a very, very low income to qualify. So basically no non-disabled, non-pregnant adults under 65 were getting Medicaid. Now there are over 600,000 people that are newly covered, which is really exciting. There's a nice link to the toolkit in the slides, which we'll make sure are shared out, that explains kind of the impact and how to get enrolled. So just want people to know that's still around. There are threats to Medicaid expansion because of some budget changes that we will talk about later on when we get into the policy side of things. You can go to the next slide, please. Kirsten. As Kirsten mentioned, states have the option to cover additional stuff on top of the things here on the left, which I won't review in great detail, but are essentially the things that you would expect to be covered by most health insurance plans. The things on the right are things that are optional, but that North Carolina chooses to cover. One that people often don't know about is that adult dental and vision services are covered by Medicaid in North Carolina, which is really great. And then there's a number of other things here that North Carolina chooses to cover. So just for your awareness, Medicaid is a very comprehensive insurance plan, and at least right now, there are basically no out-of-pocket costs to access any of these, or very, very low copays. Next slide, please, Kirsten. So we'll talk a lot more about immigration statuses throughout this presentation, but just to clarify, Medicaid, full coverage Medicaid is not available to people who are undocumented, and that includes, unfortunately, people with DACA. However, children of undocumented parents who are citizens can receive Medicaid. There has been a lot in the news lately, especially over the summer, about birthright citizenship, and the future of that is uncertain, but in North Carolina, birthright citizenship is protected. There is an injunction in place preserving birthright citizenship rights. So citizen children of undocumented parents can and should get Medicaid if they're eligible. There's also a waiting period to qualify for North Carolina Medicaid if you have other lawfully present statuses, like most commonly having a green card, unless they're a child or pregnant. So someone who is pregnant, even if they've only had a green card for a year, will qualify for Medicaid if they meet these other eligibility rules here on the left, which I won't go through in detail, but are essentially based on your citizenship status, your income criteria, and falling into one of these eligibility categories that are listed here on the left. Next slide, please. There are a couple of different other types of Medicaid in North Carolina that are not as robust. Only one of them is available to undocumented people, and that is emergency Medicaid. And that really just covers emergencies. So it's not a source of ongoing coverage or anything like that. Typically, it is something that you can apply for after the fact. For example, if you're undocumented and you deliver your baby, the labor and delivery costs can be covered through emergency Medicaid, so you can apply for that through your Department of Social Services office. And you can apply for it up to 3 months after the emergency. So if you know somebody who's undocumented and gets in a car crash, has a baby, has a heart attack, the costs of their stabilizing care at an emergency department can be covered by emergency Medicaid. So a super important thing to know about for people that can't get full Medicaid. There's also family planning Medicaid, which is similarly like full Medicaid limited to US citizens and lawfully present immigrants and people who are of the age where they can have children. But that covers things like birth control, basic doctor's visits, STI testing, and other services, including sterilization if someone decides they don't want to have a child ever. So this is a good thing to know about if there are people that need that family planning support and have a higher income threshold than full Medicaid, so they don't qualify for full Medicaid, they can still get this, which is a nice thing to know about. Thank you, Flora. I'll pause for a second. If there's anything you'd like me to repeat, let me know. I know I'm going quickly. Sorry, Flora. Any questions so far about this? Kirsten, I said we needed to go slow, and then here I am chatting too fast. Okay, We can go on to the next slide, please. There are a couple ways to get Medicaid. The first and the fastest option is online through ePass. This is the quickest way to get approved for Medicaid, so it's what we tend to recommend for people if they can swing it. You can upload your documents electronically. You can message back and forth with the Department of Social Services office about your application. So if you can get online, it really is convenient. And it is a centralized portal where you can also apply for things like SNAP, aka food stamps, energy assistance programs, and TANF or Work First. So this is the preferred way to apply. If you are not eligible for Medicaid, but your child or another dependent is, when you are applying online through ePass, or if you go to apply in person or by phone at your local Department of Social Services, you will have to provide information about everyone in your household. And that includes people who are not qualified for Medicaid. That information is really important because it's how they know what your household size is, which determines your income threshold. So if you have 10 people living in that house and only one of them is eligible for Medicaid, you still want to list all 10 of those people so that the income threshold is appropriately calculated based on how many people live in the home. There are understandably a lot of questions and concerns that people have if they have uncertain status and are applying for something on behalf of their child. There is a field where you will be asked to share the social security number of everyone in your home that has one, but you will not be asked through ePass. You will not be asked in person at a Department of Social Services what anybody's immigration status is. So I think that's really important to know because there are, and I'll get into this later, a lot of concerns about data sharing with ICE, right? And will applying for this put me at risk of deportation? There is not going to be anything on file that says you are undocumented if you are applying on behalf of your child. It's a good question about each person's income affecting your application. That is a good thing to ask when you are applying. Typically, the rule for food stamps and things like Medicaid is they look at the incomes of people who are contributing to household costs together. So, for example, if there's an adult child that's living in the home but is paying for all of their own groceries, their income may be treated separately. And certainly, if you're filing a tax return, everybody that's a dependent would count as part of your household. So a good thing to do if you are applying for Medicaid and you have a complicated situation like that, Jackie, is to check out the NC Health Navigator program I've linked here. They are free. They offer online and phone-based appointments, including in Spanish, and they can talk you through how best to structure your application. But generally, if people are living in the same household and sharing expenses, that is sort of the litmus test. If they're under physically the same roof, but their budgets are separate, any tax filing that's happening is happening separately, then it's usually treated separately. And I also wanted to highlight, because of the Medicaid managed care situation that Kirsten mentioned, when you apply for Medicaid, you're also choosing the health plan that you want to work with. And each of the 5 standard plans offer some slightly different things, and different doctors work with different managed care plans. So to give a recent example, until very recently, Duke was not taking anybody who had Medicaid through United Healthcare. So the Medicaid enrollment broker is a service that, again, is free, that can help you identify which Medicaid plan might make the most sense for you and your family or your child based on the providers you're seeing and based on the extra benefits that each of the plans are offering. So I wanted to call that out as well. That's all I have before I pass it back to Kirsten to talk more about a service called Medicaid Care Management. I know this is quite technical, so does anybody have any other follow-up questions? Flora, I hope I'm going more slowly. All right, Kirsten, back over to you.
Thank you. Okay. So, as Eleanor was just alluding to, we're going to shift gears a little bit into Medicaid care management. And this is something that everyone with Medicaid should have some level of access to, but the types of services and the providers are going to be dependent on the type of Medicaid they have, who their primary care provider is, and where they live. So, the same way that Medicaid has different plans, there are also different Medicaid care management programs. And in care management, these are folks, well, families are paired with a care manager who walks alongside them, like as they navigate all of the different systems and services that the family is interfacing with. This could be like school, economic supports that Eleanor was talking about in the previous slide, infant and maternal health, or anything really that can support their overall well being. And if there's ever a family that you're working with that is interested in learning more, we really, really recommend, and you'll probably hear us say this at least 3 more times, but we really recommend to call the member services number that is on the back of their Medicaid card to start that referral process. And just for like a little bit of like insight, when calling member services, it's something that care managers often do, and surprisingly, it's not something that you have to like, wait for an hour to finally talk to somebody. They're incredibly helpful and incredibly kind. And they're really, really knowledgeable about the services and programs that are within their Medicaid plan. So we highly recommend calling member services to talk about what could be provided through their plan. And now we're going to talk a little bit about like what the Medicaid patient experience is like. We know that Medicaid can cover a wide range of services, and we know that the copays are currently as low as $0 to $4. And there's a lot of flexibility around the types of services or resources around non medical needs. However, a lot of families struggle to find providers, especially those specialty providers. And usually this is due to low reimbursement rates, which is really unfortunate and particularly confusing. And again, this is something that Eleanor just kind of talked a little bit about as well. But like the admin side is particularly complicated, and because of this, families are often left confused about which providers they can go to or what types of benefits and services they're even eligible for through their Medicaid. And so, even though we know that Medicaid is awesome and Medicaid can do a lot of things for families, it can still be pretty tricky to actually get them connected to what they need. And oh, awesome. And I saw that Eleanor also just put some more links in the chat. Perfect. All right. And so, what we want families to really know is that in North Carolina, children and adults with Medicaid can get free preventative services like dental and vision. There is free medical appointment transportation through their plans. And this could even include like air travel or overnight accommodations if their medically necessary services aren't available nearby. And one other detail I'd like to add about the this particular benefit is that some plans are able to kind of arrange transportation through a portal, and then other plans are able to kind of do like some level of reimbursement. But again, this is really dependent on kind of like what their Medicaid kind of outlines of what they can do with it. And then each Medicaid plan also offers extra benefits that they sometimes call value added services or value added benefits. So if you were to look up like the handbooks, like let's say Healthy Blue Handbook, and you go through that, you'll see outlined at the front, like on one of the front pages, value added services or value added benefits. These are the benefits that we're talking about. And this could look like anything like free baby supplies, recently added doula services, asthma supplies, and again, we really recommend calling the member services on the back of their card to ask about these programs or ask about these benefits. And then earlier this year, our team created some simple one-pagers for families in English and in Spanish to help them learn a little bit more about what their Medicaid can do for them, as well as a couple of like specific resources of where they can get additional information related to their plan. Awesome. Oh, and I see we have a community health worker with Carolina Complete. That's awesome. Thank you for being here. Okay. All right. And what we also want families to know is that not all providers take Medicaid, and some providers will only work with specific Medicaid plans. So thinking back to like one of the first slides that we showed, that standard plans, tailored plans, and then all the way over on the right side of that table, it kind of outlines the specific providers of Medicaid. And so those some primary care providers will only work with specific Medicaid providers. And here we've laid out like the three main ways that families can get the answers that they need with regards to which providers they can use. So member services, the Medicaid enrollment broker, and this is also a person who can help them understand which Medicaid plan would best fit that family's needs and goals. And then there's also this awesome online tool. And I'm sure many of y'all have noticed that there's a lot of hyperlinks. So once the slide deck goes out, these links will take you directly to the resources that we're referencing. And lastly, Medicaid recipients have rights. The NC Medicaid Ombudsman is sort of like the family's advocate. They help families figure out how to move forward with complaints that they have, any issues that they might have with their Medicaid plan. And I'd love to add that this is like another free and confidential service. So if a family has questions or if a family has concerns, this isn't something the NC Medicaid Ombudsman is not going to take that information and use it against the family in any shape or form. And it's actually incredibly useful. So yeah, let's see. Check the chat real quick. And I saw that Eleanor also added the direct links to those Medicaid overviews that I mentioned just now. That was a lot of information that we just went over. What questions are coming up for y'all, or opinions or ideas?